Hello and welcome to today's Kauai Health Community Engagement webinar. Today's Thursday, January 23rd, 2025, and this is our first webinar of the new year, so welcome back. Thank you for those of you who are joining us live and those of you who are watching later. My name is Deborah Volleson, and I am the Director of Patient and Community Experience. I'm joined today by Kauai Health's Chief Executive Officer, Gary Herbst. And so, Gary, today we're going to talk about some really interesting topics. First of all, we're going to cover the changes regarding the new president and his administration and how those transitions might be affecting us funding-wise, but might affect us in other initiatives that we're working on. We're also going to cover some OBGYN questions and talk about family practice medicine. And then we're going to just always remind everybody that they can chat in. We'll take any question. Gary loves to be stumped. So if you are watching live.
I love the questions. I don't know if I love to be stumped, but
No, welcome back, Gary. Thank you for joining us.
appreciate that.
Did you have a good holiday?
I did. Yeah. I'm kind of recovering from all these nasty viruses that are circulating around our community. And I know it's not a question, but this year's respiratory season, which we always expect, has arrived a little bit later than usual. We generally see it start to percolate around Thanksgiving as folks start going indoors and having big, family gatherings. And then obviously that continues over the Christmas holidays and stuff, but really just started kind of hitting at the end of January, 1st of February. But yesterday I was telling our board that we were at 109% occupancy in the acute medical center. So literally, I think we had 2 medical surgical beds that were available out of our 237 at about 7 o'clock in the morning. Hundreds of patients in our ED, all 73 exam rooms were filled, and we had 39 patients that had been admitted, needed to go upstairs to an inpatient bed, but there wasn't a bed available. So they were literally holding in the emergency department. So it's not that we're unaccustomed to this. I just saw a news report earlier this morning that Community Regional Medical Center has characterized the volumes that they're seeing in their ED as unprecedented. And they also acknowledge that the respiratory season has come a little bit later, but they too are bursting at the seams. So just encouraging people again, runny noses, coughs. Well, you may have a virus, and I felt pretty sick last week. Unfortunately, I'm starting, even though I don't sound great, I'm feeling a lot better. But I knew I just had a virus. And, we don't give antibiotics for viruses. And so I just kind of slugged it out, lots of fluids, NyQuil, things like that. But unfortunately, we have a lot of people that have those same conditions. And I certainly understand that an elderly person or somebody with, severe chronic conditions, that a simple cold for them or the flu can be pretty serious. And so I don't want to discourage them from coming to the ED. But we do get a lot of people that just have simple colds and things of that nature that do come to the ED. And we see everybody that comes. But if your, reason for coming to the ED is not really emergent, I know people get frustrated because they're going to stay for long periods of time. So definitely avail yourself of our urgent care centers, our clinics, your own primary care physician. We want you to be seen. We want you to receive health care and things that we can do to alleviate your symptoms and so forth. But just want to kind of set expectations for what folks might be experiencing when they're coming to the emergency department right now.
Right. And an expectation around this virus is that it really lingers. I had a cough in the fall for like 8 weeks. And so just hang in there,
Just
write it
a
out.
week and a half now. And I think I got it a week ago Monday, and I finally felt halfway better the following Tuesday. So yeah, probably the longer that I've experienced, but yeah, I've heard the same thing.
And you have a grandbaby in your home.
Do it
So
out.
I think mine is a carrier of all of these viruses.
The Saturday before Christmas, my grandson, 11 months old, was running a very high temperature, 104, 105, and my daughter and Son-in-law took him to our ED, which they should have. He tested positive for influenza B, but because he's an infant, they could give him Motrin and Tylenol, but could not give him Tamiflu or things of that nature. So we are seeing a lot of influenza A and B. We actually are seeing patients that were vaccinated, and I'm kind of going back now a few years, but being vaccinated for the flu or RSV or COVID does not mean that you will not contract the virus. Despite everybody maybe saying that, it doesn't prevent you from getting the virus. What it is intended to do is to minimize your symptoms so that it doesn't hit you severely, that you don't end up in the hospital or end up dying. So that is the objective and the intention of those vaccines. But we have, Paxlovid or I haven't said it so while now. Paxlovid. That doesn't sound right though. But like Tamiflu for flu, Paxlovid for, and I know that's why wrong for.
They're all looking at you like, what? Kennedy, you don't know how to pronounce this?
Yeah, but yeah, lots of viruses
Yeah.
going around.
Yeah. Okay, so let's jump
Pax,
into.
Paxil. I'm not even saying God. Forget it.
Okay, so let's jump into the first question. So on Monday was the transition of power between one party to another, and the new president made the declaration that there were going to be changes in gender identity, or gender identification, and eliminating the DEI focus. And so this community member just wanted to know what changes Kauai will be making in regards to that declaration.
Yeah, as I was reading these advanced questions, and thank you for sending them in advance. I caught myself kind of longing for the days of COVID when I was answering questions about hydrochloroquine and remdesivir and stuff like that, which I
I
felt
think you've
for.
forgotten how hard that was and how political.
But I actually, in retrospect, now felt more comfortable answering those questions, which were more scientific based
Right.
than the kinds of questions we're dealing with today. So, but I certainly understand that. I don't think anybody could sit here today and answer that question with any real certainty. I mean, obviously, the President Trump took office on Monday, and today is Thursday. And I know there were a flurry of executive orders, and many of them highly controversial and so forth, and has people, up in arms right now. Some people cheering them on, others, very, very upset. But the one thing that is common among the entire population is, what does it mean? What are going to be the details of it? So, I can't say definitively how this is going to affect Kauai, but I can tell you with certainty that anytime, a patient is standing in front of us, sitting in front of us, lying in front of us, all we see is a fellow human being that needs our help, that needs health care. And that will never change. I don't care what federal law or state law or regulation or edict comes down from mountain high. That will never change how we see patients, male, female, whatever, their sexual orientation or how they, view themselves and everything. I mean, while we certainly will always show dignity and respect for a patient's preferences, whatever those might be. Again, sexual orientation or sexual identification or gender identification, religion, beliefs. We are constantly working on helping our staff appreciate cultural competency and how important it is that we recognize the preferences of our patients. And so that will never change. I mean, it might mean that, we have to ask different questions of our patients or check different boxes maybe than we do now. The government prior to Trump taking office, is always trying to learn more about the population we serve. One of the big initiatives that the federal government launched a couple years ago is to really study the social determinants of health among our population: housing insecurity, food insecurity, access to care obstacles. So now we do ask many more questions of our patients around, housing and food and things that, you probably normally wouldn't be asking when a patient's coming to your hospital, to the emergency department, or is having their gallbladder or appendix removed or something. And a lot of people might find those questions intrusive. And what business is that of the hospital? Well, again, many of these come from the federal government, that they want to collect this information. I hope for good reasons, that they want to identify opportunities to lift and elevate the health and wellness of our population, which we do too. And in fact, the roles of hospitals have been changing rather dramatically over the last several years. As I always say, we'll always be here to take care of sick and injured people, but more and more hospitals are being asked to, again, elevate the overall health and wellness of the community that it serves. They actually work really, really hard at keeping patients out of the hospital. Salinas Memorial Hospital in Salinas is a district hospital like us. Pete Delgado was their CEO, good friend of mine, just retired recently. But they actually opened up a grocery store and partnered with some community organization, pursued the Blue Zone designation to improve the quality and healthiness of foods offered in their hospital, but also to provide access to healthy foods among their community. Again, to keep people healthier and actually out of the hospital. And in the past, you would never see a hospital, in that role. But so I kind of deviated a bit from the question. But, one of the health equity is, and I know I'll speak in a moment about DEI, diversity, equity, and inclusion, but we focus very much on health equity, that every single human being that comes to us or lives in our community, we want them to have the same access to high quality, safe care as every other person in this community. And that's what we talk about equity, and we talk about health equity, that there should not be disparities in the quality or safety or access of healthcare, based on some, characteristics of that individual. Again, whether that's gender or orientation, religion, or just, race, ethnicity, it shouldn't matter. Every individual deserves access to high quality, safe care. So we will continue to pursue that. Every patient, again, treated with respect and dignity and empathy and compassion. We will always show that to our patients. So I don't, the gender question, male, female, I don't know where that's going to lead. But I don't see that it ever will change the way we provide care to our community and how we recognize our fellow human beings.
Right. And we do that. We have an internal diversity committee.
Yes.
We have an external community diversity committee, which is Diversity Community Relations Group. And so really the point of those are to make sure that people would seek healthcare regardless of how they identify.
Right.
And to remove that fear that they won't be treated equally when they step into one of our facilities.
Yeah, and again, that's very focused on health equity. Because I know we think, at least maybe I think, and I could be wrong, everything we hear about DEI, so diversity, equity, and inclusion, is more about the workforce and less about patients. Um, and I will tell you that CWIA, long before DEI was even an acronym or words, a formal movement or initiative, CWIA has always worked really, really hard to create diversity among our workforce, our almost 5,000 employees. We want our workforce to really mirror, the population that we care for. That folks that live in our community and come to us for health care are being taken care by people, that they share traits with, again, whether that's ethnicity or gender. And so um, we will never, whether DEI survives or not, to me is not does not affect how QUIA develops and nurtures and trains and its workforce. We always hire people based on their education, their experience, their skills to do that particular job that they're applying for, their attitude, their enthusiasm, and our perceived sense of their commitment that they're going to be a good fit for QUIA and that they're going to provide outstanding service to our patients, to their colleagues, to our families, our visitors. That's what we look for in an employee. Um, Frankly, we are blind to those characteristics, again, color, ethnicity, gender, orientation. That's not how we decide who we're going to hire. Again, absolutely, we respect and seek diversity. We want to be an inclusive organization, but we want to hire the best and the brightest. And so, again, I don't know what's going to happen at the federal level or the state level. I don't know who necessarily, you know, sorry for the pun, trumps, one or the other. Is it federal law or state law? Obviously, we know that in California, we're going to have a lot of conflict and a lot of debate between California laws and federal laws. So there's so much still to be learned and see how this plays out. But I really don't see it affecting the relationship with Kauai and our community.
So the question is, there's a lot of unrest in the community regarding the ICE raids. And parents in some of the rural communities have been keeping their kids out of school. They're also not showing up to work. And so the concern is that people will not seek medical care, which could lead to more emergent care in the ED. And so there's also concerns that our hospital could give immigration information to the government. And so can you address these concerns?
Yeah, so I think it was in Becker's Healthcare Review, which is a daily um, national healthcare publication that many of us in healthcare follow. Uh, it's very factual based. They try to stay away from opinions and things like that, and so it's a great source of national, local, regional information for us. So I did read. I was kind of surprised by this, but when this question was posed, apparently the Department of Homeland Security has in fact lifted um, restrictions that they had placed on the immigration and customs enforcement officers or ICE before um, ICE was prohibited from making arrests or performing investigations, things of that nature, in what they called sensitive areas. And sensitive areas includes or has included churches, schools, and hospitals. So apparently, the Department of Homeland Security did recently, perhaps, well, I would suspect in conjunction with an executive order, has now lifted the restrictions on those sensitive areas. which appears to mean that ICE can come on to the sites of hospitals and schools and churches and conduct investigations and potentially make arrests. So again, much to be determined here. Um, in my 33 years here, I don't think I've ever seen anybody from immigration or customs enforcement ever appear at the hospital here. Um, so Kauai, we have always and will continue to always comply with federal and state and local laws and regulations. We're not going to exercise civil disobedience and say we will no longer comply with laws, federal or state laws. So, so again, kind of wait and see. But there are other laws. So one of the most important laws to hospitals is a law that goes by the acronym of EMTALA, EMTALA, and it stands for Emergency Treatment and Active Labor Act. It was created back in 1996 as a powerful federal law that I do not believe there will be a single change made to that law. And if there was a change to be made, it can only be done by congressional action, could not be changed by executive order. But EMTALA requires that hospitals take care of anybody that presents itself to the emergency department. So, and again, blind to immigration status, gender, anything. We don't even ask those things. In fact, you can't even talk to the patient about insurance or anything. You gather the information necessary to provide that treatment, that care to them. But anybody that steps foot, and that will never change, is that we will provide that diagnosis, that treatment to deal with their emergency situation. They will never, ever be turned away. So that will not change. We also have never asked the patient about their immigration status unless knowing that immigration status might allow us to enroll them in benefits that might be available through the state. So we're aware that in the state of California, through legislative action and through action of the governor, excuse me, that all residents of the state of California, documented, undocumented, here legally, here illegally, that can qualify for coverage under the Medi-Cal program. We're one of the unique states in that we've expanded Medi-Cal. And so I don't know sometimes if it's necessary to know their immigration status in order to enroll them in Medi-Cal, perhaps because everybody qualifies for Medi-Cal. It's not necessary to know your immigration status, but generally speaking, we don't even ask that information. There also is another powerful law called HIPAA, which again stands for the Health Insurance Portability and Accountability Act. Again, that was passed into law back in the 90s. And part of that came very powerful privacy rules. And so we are not allowed to share patient-specific information from the patient's medical record or their billing record, their registration record. So again, including anything about their immigration status, unless we were served with a subpoena, again, something that we were not allowed to, not respond to, or we would be breaking the law. So again, I don't see HIPAA changing. I don't see the privacy rules changing. I don't see us providing immigration information about our patients unless, it somehow becomes a law that we're required to do that. Um, but I'm not aware that that is any part of these executive orders or what's being contemplated. But again, we're just days into these executive orders, so
Okay.
not a whole lot of details out there.
Right. So I had a question submitted, and then I also received a text on the chat line. So, do you have concerns regarding the FEMA funds? I know we announced last month that they have been set aside for us, not paid out, but they have been, what's the phrase you use?
Obligated.
Obligated. Okay. So they've been obligated to Kauai Health. But since that time, LA has been burning. We have a new administration.
Right.
And then this question is there a possibility that Trump might slash those funds because he's made it very clear that he's going to be really looking at spending? And you've even shared on this call how some of the ways that the state of California, how we do things with the funding and how they pull money out for Medi-Cal and then put it back in and take a little portion of it. So are you worried at all that the Trump administration is going to come in and shake that up?
I think that's my nature to be worried, frankly.
It's keeping you awake at night.
It is. So my answer is absolutely. I'm concerned, and not just because of Trump. I mean, every time we've been going through this long, drawn out approval process, some natural disaster occurs. Certainly Hurricane Helene. Is it Helene? We were in the approval process when that horrible, devastating hurricane hit North Carolina and the whole eastern seaboard. And, that caused us some hand wringing. And so the wildfires, again, just how horrible. And it bothers me to think that I'm worried about how this affects our FEMA funds. My heart really goes out to, sadly, all the people and their families that have been impacted by this. So the money is very important, but first and foremost, hoping that they're safe and no further loss of life or damage. Although it's still very active, and I guess the Hughes fire just broke out and by Magic Mountain and everything, and that's awful. But as Deborah was saying, so we have made it through every single stage of the arduous FEMA approval process to the point now that they have now been obligated, and so now it's kind of in the check right queue. So that doesn't mean, it certainly means we haven't got the money yet. And so these probably hundreds of billions of dollars that California is going to suffer in damage is going to weigh heavily on FEMA. There was, back in December of 2024, so just last month, Congress did pass HR 10545 called the American Relief Act of 2025, which added another $29 billion to FEMA's coffers. That's before the wildfires, I think, had broke out. But they put that additional money in there to fund presidentially declared disasters or major disasters like the COVID-19 pandemic, so which was declared a national disaster by the President of the United States, which made it eligible for FEMA funds. So this $29 billion in additional money that was put into the FEMA coffers is available to fund our COVID claims, which total about 50 million. So just a little small part of that 29 billion. But I think that gave me a little bit more comfort knowing that a large amount of money had been appropriated by Congress. I suspect that even though Trump, wants to continue I understand that, to cut the deficit and cut federal spending. Um, it's there's so much bipartisan support for communities that have been hit hard. I will tell you that with respect to our FEMA application, um, both our Republican and Democrat representatives, so Jim Costa on the Democrat side, Vince Fong, our Republican representative, both went to bat for us significantly to help our FEMA applications get approved. So I hope I can I hope I can count on Vince Fong that even though our president is now a Republican and there's Republican control in the Congress and the Senate, that Vince Fong will still be fighting for us all the way. Um, but that won't stop me from worrying, no doubt about it. And you talked about, so I think I mentioned in a past um, telecast that myself and Craig Castro, now the retired CEO at Community Regional Medical Center, we met with Health and Human Services Secretary Becerra, who was part of the Biden administration. And during that meeting, he brought up that the federal government, CMS, the Biden administration, continues to be concerned about states and their hospitals using these innovative, creative funding mechanisms like intergovernmental transfers, which is what CWIA does. We make a transfer of funds to our state government, who then recharacterizes them as Medi-Cal payments, draws down on federal matching funds, takes a little off the top for their administrative costs, and then sends the money back to us. So they give us our money back, but they give this federal match to us. And I will tell you that it is our lifeblood today. I don't know many public hospitals, the UCs, the counties, district hospitals, that would be open today without all of these supplemental Medi-Cal programs that have been put in place over the years. Even the private nonprofit hospitals like St. Agnes and Community and Adventist Health, they participate in a similar program called the Quality Assurance Fee, where they pay a tax to the state that gets matched with federal funds and comes back to them. So it's billions of dollars in funding for the nonprofit tax-exempt hospitals and health systems out there. And Secretary Becerra was saying that the federal government was starting to become weary of that it's, the state's really not putting up a penny of their general fund, and yet the federal government is providing all this additional Medi-Cal funding to the state of California that is going to hospitals, but some of it being retained by the state. It's not California alone that does this. This is done by practically every state across the country to help their hospitals. In many states, the state actually puts up the funds for the match using their general fund, as opposed to the hospitals putting up the funds. So I don't think that's unique to California, but many other states, they're the ones that put up the funds. So President Trump and Congress, wanting to look carefully at all these federally funded, supplemental programs to the Medicaid program. That's not new. That's not unique to the Republican Party. Again, I think for years, both Republicans and Democrats have been looking at these programs. So it makes me very nervous, no doubt about it. But again, I've really helped Congressman Vince Fong and Jim Costa really understand just how critically important those programs are to keeping California hospitals open, particularly one like Kauai that serves a county that has the highest Medi-Cal enrollment at 62% of any of the 58 counties in California.
Okay, so moving along to OBGYN, obstetrics care. So the question is, have we had any new OBGYNs sign on to join Holly? And then the community member went a little further to say their daughter and her friends are all moving their care to Fresno due to the lack of accessibility here, which is concerning because she mentioned that her daughter is having a high risk pregnancy. And even though it's only 45 minutes away to Fresno, it's still out of the area. And so she was a little concerned about that. So, have we had any new OBGYNs join Holly?
Unfortunately, we have not. Um, there's no doubt about it that the current condition of obstetrical services in our community, in fact, in the entire two-county area of Tulare and Kings, is in a serious condition right now. But I assure you that Kuya Health is not standing flat-footed. In fact, just earlier this morning in our weekly executive team meeting, we had a robust discussion around our current negotiations with a company called OB Hospitalist Group, OBHG, based out of South Carolina, a company that I actually met with probably 15, 20 years ago about establishing an OB hospitalist program right here in our community. And so when things kind of started unraveling over this last year, we reached out to them. We actually sent a formal request for proposal to them and actually a couple other local entities. But really, OB Hospitalist Group was the only company that was really in a position to respond. They are a national company. They have almost 300 hospitals that they staff their obstetrical program. I think this last year, what I read, they had 700,000 patient encounters across their 300 hospitals. They employ hundreds and hundreds of OBGYNs, again, across the nation. So we have received a proposal from them where they would place OBGYN physicians, highly experienced and skilled, that would be in-house 24 hours a day, 7 days a week. And they would be delivering any baby that need to be delivered. Whether that mom did not have an obstetrician or for whatever reason, maybe they were receiving all their prenatal care in Hanford or Tulare or Kingsburg, but they came here to deliver. So they would be there to deliver that baby. Also, any community obstetrician, whether it be Dr. Quinn or our own Dr. Sabagal or Dr. Rangel, or Dr. Ben Como with Family Healthcare Network, or Dr. Beatrian Banks with Altura, another federally qualified health center. Literally, the babies of any community obstetricians that said, wow, it's 2, 3 in the morning. Gosh, I'd love if the OB hospitalist would deliver our baby and would not hesitate. That's what they're there for, waiting to deliver babies. But they would also, for the first time, and we don't have this service in place right now, but we actually have like a separate emergency department for pregnant moms so that, if they have a concern, if they early labor or spotting or pain or, anything that is causing them concern with their baby, they come to the hospital and they bypass the general emergency department, and they go straight upstairs to the second floor to our labor and delivery triage unit. We see anywhere from 8 to 9,000 visits a year to that triage unit, staffed by incredible nurses, highly skilled in labor and delivery. They're calling physicians when they need consultative advice or direction. But we don't have physicians in-house that run upstairs and respond to them like we do down in the regular emergency department. So the OB hospitalists, from this group that's in-house 24/7 would also be responding all day, all night to that triage unit as necessary. They would also respond to labor and delivery or to mother baby or down to the main emergency department if they needed to. So they would really be dedicated to that. So we are very close to signing that formal memorandum of understanding with them. That was, again, part of the meeting today. I think it also um, would allow us to potentially be more successful in recruiting physicians to join Dr. Quinn or to join Family Healthcare Network or our rural health clinics or Altura. And that, could you imagine if you're an OBGYN and young or old, that if you're young and you have your own family, that if the OB hospice said, hey, from 10 o'clock p.m. till 8 o'clock, 8 a.m., I will deliver all your babies for you so that you don't have to come in. I'm like, wow, really? Yeah. So you just deliver during the daytime. You get to spend more time in the office. In fact, I'll deliver all of your babies if you want. And if you just want to be an office based, providing great prenatal and postnatal care and that's what happens in a lot of communities that OB hospice group goes into. Initially, they're focused on those unassigned, those moms that don't have formal relationships with obstetricians. But they find pretty quickly that community obstetricians start turning their deliveries over to them. And these are excellent obstetricians. They love what they do. They love delivering babies. They're highly vetted. Um, Even though they're vetted by OB Hospice Group, which wants to have an outstanding reputation, so they are highly incentivized to hire excellent obstetricians. They also have to apply for privileges at QUIA, where they go through a very rigorous vetting process with us, with the Department of OBGYN, with the Medical Executive Committee, and ultimately their privileges are granted by our board of directors. So we only want highly skilled, competent obstetricians working here. So we're excited about that relationship with the OB Hospice Group. In the meantime, though, and we had a physician, Dr. Edamati, wonderful OBGYN. She was hired as a locum tenens, so like a temporary physician by Family Healthcare Network. She actually came to us and said, I really love this community. I love this hospital. I would be really interested in becoming a full-time obstetrician and joining Dr. Quinn. So we made her an offer. And she was blown away by the offer. She said it was incredibly competitive and attractive. I thought she was going to sign. And wouldn't you know it, over this past weekend, she has 2 children, both sick with respiratory illnesses. She lives in Clovis. And so she had to stay in Clovis. Her husband had to work. And there she was at home with her 2 children taking care of them and saying, how can I do this? How can I be a mom and take care of my kids when I'm working in Visalia? And so, unfortunately, she informed us that she will not be accepting her offer, that she's going to find a permanent job closer to home and likely take a job in Clovis or Fresno. So we're back looking. We are aggressively recruiting and being very competitive, not necessarily matching the market, but actually leading the market in the compensation and benefits. We're being very accommodating. One of the reasons that Dr. Quinn left Visalia OBGYN was she wanted to go part-time, 4 days a week instead of 5 days a week. And they were not willing to let her do that because they didn't have enough physicians. But we did. So she's not a full-time OB. She's pretty much full-time, but we're trying to be as accommodating as we can to our candidates to create a very attractive offer here that they would not necessarily find in any other place.
Mhm. Well, that's interesting. And I'll just throw in here as mother, a working mother, we fell victim to mom guilt. Men don't have it, Gary, so you wouldn't understand.
Okay.
But
I
you
have
know,
all kinds of
but
other guilt.
women, yeah, I'm thinking, oh, her kids were sick, and all of this stuff, and mothers think of things differently than fathers do, and so my heart went out to her. But I'm looking forward to whoever is going to be coming to join Dr. Quinn, and even the hospitalist program that we're looking at.
Yes.
Because the babies just keep coming. They're just continuing to be born here. Are we going to hit 5,000 this year?
Volumes are up, without a doubt. Volumes are up in the labor and delivery triage unit as well. Interestingly, and I was sharing this with the board last night, we have a 12-bed pediatric unit, but we only had 3 pediatric patients that were admitted, which I guess is a good thing. I mean, obviously, the staff up there want to take care of kids and everything, but and we do keep all the children that we can. So our pediatric hospitalists are Valley Children's pediatricians, but they try to keep every patient they can here. I hope that it doesn't mean that kids are getting so ill that they have to go up to Children's Hospital, but our NICU too, the neonatal intensive care unit, which is a 23-bed unit, we only had 9 patients in the NICU. So even though we're delivering record number of births, fortunately, not as many of them are requiring care in the neonatal intensive care unit. And again, we pretty much keep virtually every baby that can be kept here and only transfer up to Valley Children's when they need that higher level of care. Our neonatologists are Valley Children's Hospital neonatologists. So it's just been interesting. Usually when we have a high number of deliveries, we find our NICU is similarly full as well, but that's not the case right now.
Interesting. Okay, so a little bit more bad news in regards to physicians. So the question is, why is Dr. Martinez leaving the Ben Maddox Clinic, and what is your plan?
Yeah,
Sam?
gosh, you are having me end on a low note, huh? Yeah, so we learned just a couple weeks ago, Ryan Gates, who is our chief ambulatory care officer, who oversees all of our clinics, including the Ben Maddox Clinic where Dr. Martinez currently works. So Dr. Martinez informed Ryan and myself that he was in fact leaving Kuya Health and actually going back to his roots. Dr. Martinez, when he was a medical student and was doing his, in medical school before he even, graduated to become a resident. So they do a clerkship, generally the last your 3rd and 4th year of medical school. And he did his clerkship with United Health Centers, which is a very large federally qualified health center network, primarily located in the Central Valley, predominantly serves the Medi-Cal, underserved, impoverished population. And that meant a lot to him. That's kind of really his passion. And so when he graduated from his residency as a family medicine physician, he joined United Health Centers, and that's where he was working. But he's actually married to Dr. Christina Patty, who is a family medicine physician at Visalia Medical Clinic. They have 2 young children. They live in Visalia. He wasn't working in Visalia for United Health Centers, and so he wanted to move closer to home. And so he came to work for Kuya Health and has been working in our Ben Maddox Clinic, where he largely sees a commercially insured population and the Medicare population. So he doesn't see the Medi-Cal population in that Ben Maddox Clinic. And so he's been torn, continues to be drawn. In fact, United Health Centers has continued to woo him to come back, probably since the day he left. And I think that passion just started pulling on his heartstrings just a little too hard. And he said, I really miss it. And while I really enjoy what I'm doing and taking care of the patients I do right now, I want to go back to that. They also offered him quite an opportunity. So he will now be the associate medical director for the entire United Health Centers organization. So all of their clinics, he is the associate medical director. So not only will he be providing direct patient care, but he can have a pretty significant influence over the entire organization and the care that they provide and their mission and so forth. So um, pretty hard to compete with that. So we understand from Dr. Martinez that he initially will be posted in Hanford in United Health Center's clinic there, and then after 7 months he will come back to Visalia and be stationed at the United Health Center that's in the Old World Market over there off of Mooney and can't remember where the side street is. Um, so United Healthcare just opened a brand new clinic there about a year ago. So that's where he will be located. I do believe that United Health Centers takes all patients and all forms of insurance. So Medicare, Medi-Cal, but also commercially insured. So, I'm certain that Dr. Martinez is hoping that his patients follow him. Obviously, following him to Hanford for 7 months might be a little bit more difficult, but certainly when he comes back to Visalia, maybe reestablishing with him, or perhaps you never left him. If you're otherwise healthy and only see the doctor a couple times a year, then maybe you can wait for him to come back. So obviously, we're a bit heartbroken that we lost him. He's an outstanding physician and individual. The door will always be open for him. In the meantime, our beloved Dr. Roach, Bill Roach, who is the Marcus Welby of Visalia. Dr. Roach works full time right now for Kauai in our rural health clinics. I think he spends a great deal of his time in Lindsay. But with Dr. Martinez leaving, which I think is the end of this month, Dr. Roach is going to work 1 day a month in the Ben Maddox clinic and is willing to, continue to see Dr. Martinez's patients. I will forewarn you, though, that Dr. Roach has recently informed us that he finally will be retiring. We thought the day would never come, but it has. So, talk about giving us a lot of advance notice. He'll be retiring at the end of the calendar year. So another 11 months with us. In the meantime, that we will continue to, again, actively, aggressively recruit for new family medicine, internal medicine physicians to replace Dr. Martinez and then ultimately to replace Dr. Roach as well. We have some outstanding family medicine residents that will be graduating in June, having completed their 3-year residency program. We're in active discussions with a number of them, hoping that they fell in love with Visalia and Kauai Health and that they'll want to stay here and continue to practice and live in our community. So, there's some good prospects out there, but definitely disappointing.
Okay, so I want to verify, you said Dr. Roach will be practicing 1 day
A week.
a week. Okay, you
Yes.
said 1 day a month.
Oh, did I say math?
So I just- no.
I meant a week.
That's good, 1 day a week.
I think I
Okay,
can
so we-
formally and publicly announce this. So we are working with the county of Tulare to acquire space in, I'll call it the old Cigna building, but we're going to drop that name as soon as we can. But it is the large 2-story building that is located on Acres, on the west side of Acres between Cypress and Tulare Avenue. So it's where the Tulare County Sheriff's Office is located. It's where the Tulare County Voter Registrar's Office is located. I think there's a formal a testing center that is there. So Kauai has entered into a letter of intent or a memorandum of understanding with the county to lease 13,000 square feet on the ground floor and a first right of refusal on the entire second floor, which I think is around 45,000 square feet. And so we also just recently signed an early occupancy agreement with them that will allow us to come in and start doing the demolition on the ground floor immediately while we finalize a 10-year lease agreement with the county. So the county will continue to own that building, but we will be leasing space in that building specifically to develop medical office space for physicians. And so that will be our primary new location for new primary and specialty care physicians that we recruit into our community, as well as those that might want to, change their practice, location right now. They're, maybe they want to join Kauai Health in some way. Also, we work very closely with Key Medical Group, probably the single largest physician independent practice association in Tulare and Kings County. They are the primary medical group to the Humana Medicare Advantage program. They are our partner in our own health plan, Sequoia Health Plan, that operates the Humana product in Tulare and Kings County. So Key Medical Group formed their own medical group a number of years ago called Key Medical Associates, or KMA. KMA continues to recruit new physicians into their medical group, but like us, they are running out of practice locations to place their physicians. And so we likely will be subleasing space in that Acres facility to KMA to place physicians. So we're kind of agnostic. We just want physicians to come and practice and live in our community. And we want them, obviously, to be loyal to Kauai, to utilize our facilities for diagnostic testing and surgery and other, treatment. And so we want them to use us. But whether they come to work for Kauai Health or Key Medical Associates, we're really again indifferent, and we provide financial support to Key Medical Associates to help them recruit physicians into their medical group and into the community. So that's an important location. And you talk about pedal to the metal. This might be one of the fastest construction projects that we ever embark upon and achieve. I think Mark Mertz and Kevin Morrison, our director of facilities, Mark's our director of strategic planning. I think they're gunning for this summer. Here it is, and maybe even sooner than that, to have this space up and ready for occupancy. So
Yeah.
excited about that. We will soon be opening a brand new clinic in Woodlake, while at the same time keeping our existing clinic open in Woodlake. So Dr. Medina, a family medicine physician in Woodlake, will be moving in that new clinic. Dr. Alash, who's our pediatrician, he will remain in the existing building and really develop that into a robust, comprehensive pediatric facility, while Dr. Medina builds out. We're bringing women's health, behavioral health, other services to that other Woodlake clinic. And I think you will see Kauai continue to look for other opportunities to develop clinic sites, in and around our community to provide spaces for physicians. So some of it is just months away. This physician that was told maybe 2 years away, we may not have been able to publicly announce yet the Acres project, or this physician might be looking for something different and would require maybe a new clinic to be built that could be a couple years away. So, but lots of activity going on.
Okay. Well, thank you, Gary. You've answered all of the questions.
All right.
So,
And
yeah.
right on time.
Record time.
Wow. All right. Well, thank you all again for joining us for this month's telecast. Whether you're joining us live right now or watch us later on a recording. Again, thank you for all of your challenging questions. I appreciate it. I continue to encourage you, even not to wait to the next telecast. I know all of you have a direct line to Deborah. When you shoot her an email, she'll send it to me. We have this question that's come up, and we won't wait to answer that question. We want to both be very accessible to all of you. You're a very important part of the Kuya Health family, and whether you're an ambassador or a member of one of our community advisory committees, EDAC or PFAC, whatever role you might be in, we want you to be the first to know what's going on at Kuya, and to feel like you're very highly informed and knowledgeable and can speak the truth on our behalf. So thank you for staying with us, and hope you all have a great weekend, and we'll see you next month.